You see that this part is dull and this part is sharp. So if you can close your eyes and let me know if you feel dull or sharp.
Dull.
First, checking on her face here.
Sharp.
Checking on her arms.
Dull. Sharp.
Checking both sides, comparing her sensation, her pain, her touch on both sides.
Dull.
Wonderful. Checking her legs.
Sharp.
Checking her feet.
Dull. Sharp.
Wonderful. And so her sensation is intact. Now moving on to her deep tendon reflexes. So with the deep tendon reflexes, first I'm going to check her bicep, tricep, using my reflex hammer here, radial, brachioradialis, I apologize. So that's bicep, tricep, brachioradialis, knee. Wonderful. And her plantar or her Babinski reflex. And what I should see is that her toes curl up like that. And it is intact. Next, moving on, I'm going to be checking her, can you please lay down? I'm going to be checking your heel position. Sorry, Grace. Thank you. So, with the heel to shin, if you can take the heel of one leg, place it on the opposite knee and drag it down to your big toe. Wonderful. Not only is she able to follow commands, but she's also showing me that she does not have any cerebellar disease. Great. Here, Grace, let me take your hands here, and we're going to sit up. And next I'll be checking for Romberg sign. So if you can stand up with your feet together, look straight forward. Great. And I'll be looking for any significant swaying. If you can close your eyes, Grace, please. And so there's slight swaying, but nothing too significant. If she were to have significant swaying, this would be indicative of posterior column disease. Great. So she is negative for Romberg sign. So go ahead and sit down. So after your neuro here, okay, let's move on to your heart. So I'll be looking at your heart here, palpating for any thrills or heaves. There are none. Checking the point of maximum impulse, which is in the fifth intercostal space, mid-axillary. And I can palpate that. Great. So now using my stethoscope, using the diaphragm of my stethoscope, I'll be listening for heart sounds. So first the mitral, Erb's point, aortic, tricuspid, and pulmonic. Wonderful. And her heart sounds are present. Using the bell of my stethoscope, I'll be listening for any bruits. And her finding is normal. She does not have any bruits. Now moving on to her lungs. I'll be inspecting the thorax and lung itself, checking the skin in the front and in the back here. Next, I'll be checking her anterior, posterior, and her transverse diameters. I will place my hands like this on her back. If you can take a deep breath for me, Grace. Wonderful. So I will be checking her thorax to make sure it's not concave, convex, or barrel-chested. Next, I will be palpating for fremitus. Grace, can you please say 99? And
99.
And go ahead and repeat.
99.
Keep repeating.
99. 99. 99.
Wonderful. So if I heard increased vibrations, it would be indicative of consolidation in the lungs, and she does not have that. Next, I'll be percussing her lungs. So when you're percussing, you move from right to left, a little lower on the left, right, a little lower on the right, and so forth. So I'm going to be percussing your lungs. Grace, just breathe normally. Wonderful. So I should hear resonance, and I did, so it's normal. Next, I'll be auscultating her lungs. Using the diaphragm of my stethoscope, I would follow the same pattern. Right, left, a little lower on the left, right, a little lower on the right, and so forth. So, Grace, if you can please take a deep breath for me. Wonderful. Deep breath again. Wonderful. Deep breath. Great. Deep breath. Keep going. Keep going. Wonderful. So I'm listening for any adventitious breath sounds such as wheezes, crackles, or rails. And she does not have those. It's actually clear. So that was her posterior lung sounds. Now I'm listening for her anterior lung sounds. Deep breath. And deep breath. Wonderful. So next, I will be moving on to her vascular system. So her vascular system, first I'll be checking her skin overall, checking the color of the skin, checking the temperature. Next, I'll be looking for edema. Edema is rated from 0 to 4+. And edema is any swelling in the body here. So checking for any swelling, there is none. Checking the turgor of her skin. So I'm going to pinch her skin, and I did not see any tenting, so it is a normal finding. Next, I'll be checking her capillary refill by performing the Blanche test. So you press down, and I should see her color return to normal within 2 seconds, and it is intact. Next, I'll be checking her pulses. So first, her carotid, one at a time here. Pulses are rated from 0 to 3+. 3+ meaning bounding or normal. You okay? Okay, sorry. So first, her carotid. Now her brachial, her radial, femoral, popliteal. So for the popliteal, I would place my fingers like this around her knee. So popliteal pulses present. Checking next her posterior tibialis and dorsalis pedis. So wonderful. All her pulses are present and they are all intact. Next, moving on, I'm going to be checking her abdomen. So if you don't mind laying down here, Grace. You're doing okay?
Yes.
Okay, wonderful. So now moving on to her abdomen, I would inspect the abdomen itself, check for any scars, any lesions, any striae. And her abdomen looks fine. I would also have her, can you lift your head, please? At least 30 degrees, raise her head. And I would check the umbilical area for any hernias. And she does not have any masses or hernias showing here. Go ahead and rest your head. So next I'm going to auscultate her abdomen. And the reason why you auscultate before you percuss or palpate is that when you palpate and percuss, it actually stimulates the gut. So let's auscultate her her abdomen, using the diaphragm of my stethoscope here. I'm going to first be listening to the right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. So I'd be listening for any abnormal sounds such as hypoactivity or hyperactivity. Using the bell of my stethoscope, I'd be listening to the abdominal vessels, renal, aortic, iliac, and splenic. Wonderful. So next, I'm going to percuss her abdomen in all 4 quadrants. Just breathe normally, Grace. So right upper, right lower, left upper, left lower. So her percussion shows no abnormal findings. Next, I'm going to palpate her abdomen. So first superficially and then deep. Grace, let me know at any time if you feel any pain. What I'll be looking for also is watching her face for any grimacing or wincing, which also would be indicative of pain. So first superficially in the right upper quadrant, moving down to the right lower quadrant, left upper quadrant, and left lower quadrant, just superficially palpating. And now let's do it a little deeper. So let me know if I'm hurting you, Grace. Checking all 4 quadrants again. Going a little deeper. At this point also I'll be checking for any rebound tenderness. And rebound tenderness is when you press down and then lift up, that's when the patient experiences pain. So any pain, Grace?
No.
Okay, if she did have rebound tenderness, that would be indicative of peritonitis or maybe abdominal wall disease. Next, I'll be checking for Murphy's sign. And Murphy's sign is here in the right upper quadrant. Any pain, Grace?
No.
So she is negative, but a positive Murphy sign would be indicative of gallbladder disease or cholecystitis. Next, I'll be checking for McBurney's point. And McBurney's point is from the umbilicus to the iliac crest, about 2/3 way. I'm going to press down. Any pain?
No.
She is negative, but if she were to have a positive McBurney sign, that would be indicative of appendicitis. Can you please sit up for me, Grace? Thank you. Next, I'll be checking for CVA tenderness. Do you mind moving this way just a tad bit here? So CVA tenderness stands for costovertebral angle tenderness. I'll be percussing her kidneys here in her back. Any pain?
No.
She is not experiencing pain. If she were, it would be indicative of pyelonephritis or possibly even kidney stones. So that concludes the abdominal portion of the cysta of the head to toe. Next and lastly, I'll be checking the genitalia and the rectal area. So for the genitalia and rectal area, I would first palpate and inspect the femoral and inguinal areas for any hernias, any masses, palpating the lymph nodes itself there. Next, I would be checking the genitalia itself. Any redness, any swelling, any abnormal drainage, any rashes. Next, moving on to the perineal area, the same. Any rashes, any swelling, any drainage, any tenderness there. And lastly, in the rectum, checking the skin integrity, checking for any swelling, redness, rashes, any abnormal mass such as a hemorrhoid. And lastly, because she is a female, I would perform a breast exam. And Grace, do you have any more questions or concerns for me?
No.
Okay, wonderful. If she has no other questions or concerns, I would then remove my gloves. Then I would wash my hands. And I think that's it. So that concludes our head to toe assessment. Thank you, Grace, for your time.
Thank you.